If you are athletic, you probably have had some aches and pains. In some cases, you might have had an injury or two. It happens to all weekend warriors. Eyewitness News reporter Mark Schumacher has been there, and tonight he takes us along as he deals with knee problems.
For me, it was a basketball game 25 years ago in high school that really changed my life. At that time, I suffered a knee injury, and over the next 25 years, I've had surgeries, I've had more injuries, a lot of chronic pain and discomfort. Well, finally, I've decided to do something about it.
Hey guys, how you doing? Is Mark here?
The man with the plans for my banged-up right knee is Dr. Al Desimone.
Hey Mark, how you doing? So we're gonna do this thing?
Desimone is an orthopedic surgeon who specializes in knee reconstruction. Since I'm too young for a knee joint replacement, I've chosen reconstruction.
You can really feel.
I just feel it's almost like a hinge.
It's slipping. It's slipping in and out of place. Your knee is grossly unstable, and that's a functional issue as well. I mean, you can get out of your car and you could turn the wrong way and your knee will give out.
The x-rays are even more telling.
When you hear people talk about bone spur, is that a bone spur?
That is typical.
I mean, a layman's term?
Yes, that's typical of a bone spur.
So this is not supposed to be there?
It's not supposed to be there.
Okay.
And when you compare my left knee to the right, you can see all the added growths on the bone, each caused when one bone bangs against the other.
And when I look in this area, there should be a nice dark structure which is consistent with the anterior cruciate ligament, and that is completely gone.
My MRI verifies Desimone's diagnosis. My anterior cruciate ligament, the ACL, the main stabilizing force in our knee joints, is totally torn. Years of being a weekend warrior have taken their toll.
Actually, I think it's inherent that we fix these injuries initially so that we can prevent your knee from undergoing further damage.
The fix in this case will be to replace the ACL. Now, this can be done in a couple of ways, either using my own tissue or a cadaver graft. Dr. Desimone prefers my own tissue. So what he'll do is harvest a section of my patella tendon, which runs down the front of the knee, and use it to replace my ACL.
So I think it's going to give us the best hold initially when we're reconstructing the knee so that you can have a tight knee from the get-go.
Okay.
With the operation still a few weeks away, Desimone wants me to use that time for what I call prehab, strengthening to make sure that the recovery after surgery is easier.
We want to strengthen the quadricep muscle. We're also going to do some hamstring strengthening.
You know where to wait, right?
Coming up at 6, you'll roll right with me into surgery. The moment of truth has arrived. I'm Mark Schumacher, Channel 10, Eyewitness News.
Now we get a sense of what athletes go through.
Oh, yeah.
Can't wait till 6
Painful.
o'clock to see what happens there.